I want to be there for them, if not in person, at least a voice that they can hear at the end of the day.
Lights out for this sign. This doctor's office is closing.
While most patient appointments are being done over the phone because of COVID-19, physicians say they can't battle the virus if the province isn't billing them the same amount for calls as they would an in-office visit.
This is Dr. Larissa Saraditz's last day at the Riverbend Medical Clinic in Southeast Calgary. With canceled visits, most appointments are done over the phone or through video conferencing. But physicians say the province is paying them half of what they get for an in-person visit.
Of that $20, we have to give $6 for our operating costs here in the office, making my total fee for that hour visit potentially $14. That will not cover my insurance costs or medical legal liabilities.
Saraditz says it's a flat rate for telehealth calls.
Dealing with patients' overwhelming anxiety and fear about this pandemic, I can assure you that that phone call does not take 5 minutes.
Staff have been laid off and doctors will mostly be working from home, taking calls with patients, but still following Alberta College of Physician and Surgeons guidelines. Saraditz says 36 other clinics in the province are closing because they're in the same position. The Edmonton Medical Staff Association says doctors could go bankrupt, saying the government is penalizing doctors for protecting patients with virtual care. In a statement, the province says we recognize the pandemic is placing unprecedented demands on physicians and will announce more support in the coming days for all physicians to care for patients through phone calls and other virtual visits. The province recently announced a new billing code for pharmacists so they can screen for COVID-19 and the new Babylon app, which gives Albertans access to a small group of doctors. But some say the app doesn't provide the continuity of care that family doctors offer. And if physicians are going to continue with telehealth, they want Alberta to follow other provinces that pay the same as an in-person visit.
That's what we're asking for. In order to keep our patients with mental health issues, any chronic illness safe and supported, we need them here in the community so as to not overwhelm the acute care services.
In Calgary, Crystal Laderas, City